If you look in the mirror, can you pick out which facial features you've inherited from your parents? Perhaps you have the same nose as your mum, or the same hair colour as your dad. But what happens if you inherit something more serious than eye colour?
Some diseases or disorders are caused because of a change in our genetic code. This means that if one or both of your parents have a genetic disorder, there's a chance that you or even your children can develop the disorder as well. Sometimes a change in genetic code can happen for the very first time in you. But how can we find out whether you have or are likely to develop a genetic disorder? What does this mean for you and your loved ones, and what support is available? This is where genetic counsellors like me come in.
Genetic counsellors are highly skilled healthcare professionals, having received specialist training in genetic medicine as well as in counselling skills.
Someone might have genetic counselling for a range of different reasons. For example, wanting to find out whether you or your child has inherited a gene change which is causing a health problem, wanting to find out the risk of developing a genetic disorder in the future, or as a couple wanting to find out the risk of having a baby with a genetic disorder.
When an individual or a family meets with a genetic counsellor, the counsellor will carefully explore the patient's family history and create a family tree. This is important for risk calculations, which help to determine how likely it is that an individual or their child will develop a genetic disorder.
The genetic counsellor may then offer the patient genetic testing. When the results are back, it's the job of the genetic counsellor to deliver the results in a clear, compassionate and sensitive way. It's our job to explain what the results mean for the individual and their family, as well as explaining difficult and sometimes complicated genetic information in a way that anyone can understand.
The genetic counsellor will listen and address any emotional or medical needs, as well as explain the options the patient has regarding the diagnosis, so that the patient is empowered to make their own decisions about their way forward.
Genetic counsellors provide unique support for patients. We not only give results in a clear and meaningful way, but we also provide necessary counselling for the psychological, emotional and medical needs of patients.
More information about genetic counselling, as well as other helpful guides, can be found at the unique website.